Hello, Claire. My name is Carolyn. Hello, Claire's mom, Sandra. How are you today?
I'm good. How are you?
Fantastic. Thank you for coming to the office for your visit.
Sure.
First, I want to go over the things that we're going to do today. Okay, Claire?
Mm-hmm.
Oh, we got a giggly one. Okay. So, first we're going to weigh you. Okay? We'll find out how tall you are. I'm going to use this machine here. It's a BAI machine. This is going to calculate your body mass index and your percent fat in your body. Then I'm going to use a body composition scale, which is down on the floor over there, to determine your visceral fat and your muscle mass. And I'm going to use this measurement here, it's tape measure, to measure your hip to waist ratio and your wrist measurement, all right, to decide your body frame and your propensity for high blood pressure, cardiac disease, and diabetes. I am going to check your temperature, right? Because we want to find out how you're doing, maybe see if there's any problem with your thyroid. I am going to check your blood pressure and your heart rate with my little machine here that'll go on your wrist. Okay, and I'm going to discuss your basic metabolic rate with you, and I'm going to do a small physical exam. I'm not going to touch you. I'm just going to look at different things on your body. Is that okay?
Mm-hmm.
How's that, Mom?
Sounds great.
Fantastic. Okay, before we start out here with figuring out your BMI, I need to do a fit test with you. So we have a couple of questions for you. Okay, I need to know the frequency of exercise. How often during the week you exercise? Which number is it? Daily, 3 to 4 times per week, 1 to 2 times per week, a few times per week. How many times do you exercise?
5.
Okay, so that's a number 5. All right, so we want to know the intensity. Do you have intense exercise, medium intense, or just regular exercise?
Medium intense.
Okay, so that'll be a 4. And how long do you do it for? Less than 15 minutes, a half hour, an hour, how long?
An hour.
Okay, an hour. So then you have a 5 times 4 is what?
20.
20. 20 times 4 is what?
80.
All right, that's greater than 60, which means we will set you up as being fit, as athletic on our machine. So what I'm going to do, okay, we turn it on. Before you came here, I already set you up with your height because you told us that you were 5'9" before you came here. So I need you to stand up. Okay, I want you to hold the machine. Your thumbs have to go over the top and your hands have to go around, okay? All right, when you hold the machine, we press start. Okay, you have to wait for the little beeping to end. Okay, fantastic. Thank you, we have figured that out. What this machine does is it measures electrical current in your body. This gives out a little current, and because there's more water in your muscle and your bone and less water in your fat, determining how much electrical current goes through your body will tell us how much fat there is in your body. Do you understand?
Mm-hmm.
Okay, good. Now we're going to go over to our body composition scale. It's a good thing that you're able to take your shoes off so quickly because you have to be barefoot when you go in this machine. Okay, so I'm going to turn the machine on and I'm going to lift this up. All right, so we have to wait until the scale zeroes, which it has zeroed. So I need you I had already put in your height in the machine before you got here. So I'm going to push for the person who you are. I need you to stand on the machine, feet flat on each side, your hands around and at a 90-degree angle. Okay, this is giving us our weight, and then stay on the machine and it's going to calculate out for you your percent muscle and your percent visceral fat. Okay, beautiful. So now I can look at these on here. All right, so I have your percentages and your metabolic. Okay, fantastic. Now, today, did you drink a lot of water?
Yeah.
Okay, and did you exercise in the past 12 hours?
No.
No, not at all? You didn't have any practice?
No.
No, okay. All right, this particular machine, both of them will calculate your percentage of fat, but that particular machine is less accurate if you're dehydrated or if you've exercised in the past 24 hours. It's also inflates the percent body fat in females, which is why I use this for the fat, but I use that for the visceral fat and for the percent of muscle that you have, okay? Alrighty, so looking at your calculations, okay, your BMI is 28. When you look at our little graph here, all right, so you're a female in this range, you're at a normal BMI, okay? On this machine, your fat is calculated at 38%, whereas, I'm sorry, this one is 28% and that one is 38%. We're gonna go in the middle, right? So we're gonna say you're about 32%. So looking at our graph over here, you're borderline going on to the overweight side, okay? So you're right on the borderline. All right, your muscle calculation is 27%, which is above average. Way to go. Keep up the muscle activity there. And your visceral fat is 5%. Okay, there's two types of fat on our body. We all see people that have little rolls of fat, or you see cellulite, and we can all see that fat, which we can assess with our own eyes. But there can be fat in the inside of our body called visceral fat, and the reason why we measure it is because the higher the amount of visceral fat, the more circulating fat there is in your blood system, the more likely it is you're going to end up having coronary artery disease and diabetes. So your visceral fat is a healthy fat, so keep up the good work, okay? All right, so next we're going to do our hip to waist ratio. So I need you to stand up. Okay, now we're gonna have to measure you under your sweater there. So at your belly button, all right, you hold it at your belly button with one finger, and you go all the way around. Okay, put that in there, okay, and we'll, okay, so that's the first measurement. Now around your hips, all right, so down a little bit more. Yep, we're going to do the widest part of your hip. Down, okay. There we go. Okay. Alrighty. Okay. Alright, so. Alright, so. The reason why we measure that is because body types will decide what kind of a risk you have for heart disease and diabetes. So we've all seen people that are shaped like this, the apple, right? And then we see other people that chunkier in the thighs that are shaped like that, like a pear, right? When you are an apple shape, this fat here is more likely, it's correlated to a higher risk for disease. So that's why we want to put you in a ratio and see where you fall on that, in the ratio. And your ratio puts you borderline. So we're going to have to do some work right over here. You know, hula hoop? No. Okay, beautiful. All right, next we're going to measure your wrist circumference. Mom, do you understand everything that's going on?
I do. This is excellent.
Fantastic.
I'm very impressed.
All right, so. Whoops. Make sure it's in before you press the button, right? That's the most important part. Otherwise, you'll have a 37-inch wrist. Okay, so let's see the measurement for that. Okay, so. All right, the reason why we measure your wrist is to determine your body type. Okay, whether you have a small frame, medium frame, or a large frame, and you are in a large frame, which means you're going to have more weight associated with your bones, because clearly you can see that your bones are larger than some other people's. Okay, now we're going to do blood pressure. This is fun. We're going to do it on your left arm, wrist actually, right? Works better on the left wrist. So we're going to put it on here. Your monitor has to be right below your wrist, facing the inside of your body, okay? So, like that. All right, Claire. So, what we're gonna do is I'm gonna press start, and your arm has to be at the correct height in order for this to take the correct measurement. It's gonna have a red sign when it's not correct and a blue sign when it is correct. Now, this cuff is going to inflate, so it's gonna be a little bit tight on you, but it's not gonna hurt. All right, so we're looking at, red. Put it up a little bit, up, down a little bit. Oh, wait a second. No, let's start it all over again. It helps if it's on the right way. It was upside down. see? Alrighty. Okay, red, blue. Alright, so you leave it on there until we get our result. Do you feel it inflating?
Yeah.
Okay, that means it's working. Do you know why we measure blood pressure?
No.
Because we want to make sure that your body isn't forcing your blood vessels to expand too much because of disease. Because if they expand too much, they can burst, right? They can cause problems, like a balloon if you put too much air in the balloon. And what happens if we do that?
Pops.
Yeah, bad stuff. Okay, we're also going to measure your heart rate. Okay, good. 116 to 62. Wow, you're a little low. Good for you. Keep up the good work, right? You don't get lightheaded, do you?
No.
All right, then it's not too low. 116 over 62 and 71 beats per minute. Okay, the heart rate measures how hard, how fast your heart has to work in order to pump the blood through your body so you can maintain good health. So what we have to do when we do exercise is we're exercising our heart so we can have more efficient, good pumping, right? Then we don't need as many pumps, right? So it's kind of like a bicep, right? The more you exercise it, you only need one punch to knock your brother out, right? As opposed to multiple not so good punches, right? So, all right, that's why we measure your blood pressure. Alrighty, so now we're gonna measure your temperature. All right, I'm just gonna put this on your forehead, right? For once, I'm gonna push it here and press the button, and we're gonna see what your temperature is. Perfect, okay, 98.7. Your temperature is good, so it doesn't indicate any problems with your thyroid necessarily. So we want to calculate your BMR, which is your basic metabolic rate, your basal metabolic rate. It's the amount of calories that you need in order to maintain your normal weight right now. Okay, so if you want to lose weight, what we need to do is eat less than what our body's burning. And if we want to gain weight, we need to eat more. If we want to maintain our weight, we eat the correct amount. All right, so what we do is we put it into a chart, right? We use your age, whether you're male or female, your height and your weight to determine what your rate is. And I did that before you came here, and we did it on the machine, and it came out to roughly 1,700 calories per day. That's before you do anything at all, before you lift a finger up or do anything else. So do you exercise? You said you do it 5 to 6 times a week. What do you do?
Strength conditioning and softball.
That's a lot. How many times a day do you do it?
Basically every day.
Basically every day. So you would be an active person, right? So what we would do is take your basic metabolic rate and times it by a factor that correlates with your level of activity, which is high, to come out with our recommendations for calories. Because you're 14, the American Academy of Pediatrics decides that at your age, you should have 2,200 calories per day. Why would you need more than an adult?
I don't know.
Because you're growing. All right. So you're growing. So when we have our calories, do you want those calories to be calories from cheese doodles or from a cheese stick?
Cheese stick.
Why? Do you know?
Healthier.
Why is it healthier? What does it have in there?
Calcium. That's
good. And protein, right? And cheese doodles, what kind of vitamins and minerals are in cheese doodles?
None.
Are you sure?
No.
Okay. Yes. Now, there are no vitamins or minerals in anything that you have to pretty much open a cellophane bag to eat. Okay, right, Mom?
Absolutely.
Okay. So, all right. So now I'm going to go over a physical exam. I'm just going to look at a few things on you. Can you open your mouth? Tongue up and down. Tongue out. Okay. Can you place your lip down so I can see your gums? All right. Let us see those probably little teeth. When are they coming off those braces?
April, hopefully.
All right. I'll cross my fingers for you. Okay. Your eyes. Can you pull your eyes down so I can see underneath? Okay. I don't see any red circles. Are your eyes dry?
No.
No? All right. Look up at the light for a second. And look over at me. Okay. Do you have any problems seeing at night?
No.
So no problems with night vision. Okay. How often do you go to the dentist?
Once every 6 months.
All right. Any problems with the dentist?
No.
Okay. Beautiful. I need to look at your arm. Can you take your... Okay. I just want to see the back of your arm. Okay. All right. Beautiful. Your hair. Do you have any issues with your hair? Is it brittle?
No.
Does it fall out? Do you have any sparse areas? No. Okay. All right. And can I see your fingernails? Well, that's not very helpful. because they're painted black. Do you have any white spots or any lines in your nails when there's no nail polish on them? Okay, are they brittle? Do they break easily? No? Okay. All right, so do you have any issues with smell or taste? No, everything's fine?
Yeah.
Okay. Do you have any allergies?
Yeah.
What are they?
Dogs, cats, dust mites, pollen.
A lot.
Yeah.
Fantastic. What about foods?
No.
No. Okay. Do you take any medication?
Zazol.
What's that?
An allergy antihistamine.
Oh, okay. Who gives that to you?
Doctor.
What kind of doctor?
Allergy doctor.
Perfect. Okay. How about your diet and what you drink? What do you drink every day?
Water.
Do you drink soda?
Not really.
Not really. What about juice?
Sometimes.
Coffee?
No.
Okay. What about your diet? Do you have a healthy diet or?
Yeah.
Yeah. What's healthy?
Fruit.
A lot of fruit?
Yeah.
Okay. All right. How much do you sleep?
9 hours.
Do you have any problem sleeping at all?
No.
All right. So you wake up well rested?
Mhm.
Okay. Beautiful. And if we give you some recommendations, do you think you can make some changes to your diet?
Yeah.
Okay. You think you can make some changes to your exercise?
Mhm.
Okay. Fantastic. Well, thank you for coming. And
Thank you.
I think that I'm going to make some recommendations, and I'll see you within the next couple of weeks.
Thank you.
Thanks.